Hello guys, welcome back to my lecture series on neurology. And in this lecture, I will talk about the stroke. Actually, we see that in the heart attack, we see there is blood supply interruption to the heart, but in stroke, we see the blood interruptions to the brain. When there is interruptions of blood supply to the brain, the function of the brain is lost. The brain will not work as it does in normal. And we see many neurological symptoms that occurs to our body, like there may be walking disabilities. We cannot see well, and the speech will be disrupt as well. At the end, we will see that we will come to know the definition, the pathophysiology, like how the stroke is caused, and the types of the stroke. What is the stroke? Actually, when we see that there are cerebral changes to our brain, to our body, we see the rapid onset of things like the patient is not able to speak, even there are changes to his eyes, and that occurs like more than 24 hours. We see that there is stroke, and the stroke actually is the leading to death, and there will be no apparent cause, like we will not have other causes to death other than the vascular, like we will have the blockage of the arteries. In that case, the cerebral arteries may be blocked. And in stroke, the function of the brain is rapidly lost, and that is due to the disturbance in the blood supply to the brain. We see that the cerebral arteries will be interrupted due to some clots or the fatty deposition inside the arteries. And when stroke, there is blood flow to part of the brain is stopped, and we see that the brain attack, like we see in the heart attack, there is also a brain attack due to the blood is stopped to the brain. And in the pathophysiology of stroke, we see that the blood is supplied to the brain by the cerebral arteries, the from the arc of aorta. We have the brachiocephalic arteries, and then we see the carotid arteries that eventually gives rise to the cerebral arteries, and that supplies the brain. And when there is blood clot in the cerebral arteries, we see that there is no blood supply to the brain tissues, due to which the brain area is affected, and the that brain area called the ischemic part of the brain, and that is affected area. It can happen to any part of the brain. Actually, mostly the cerebral area is mostly affected because there is no other collateral blood supply to the brain. And we have three types of stroke: the ischemic strokes, because we see the ischemia to the brain, like when we will have a blockage of a cerebral artery, the brain tissues may be ischemic due to the loss of blood supply, and that may be occurring in the diabetic patients, sometimes in patients with lipid profile dysfunctions, and the hemorrhagic strokes, because we see the arteries are ruptured or the disrupted, and the arteries are opened, and the mini strokes that occurs within 1 hour, like they will not last more than 1 hour. That are the transient ischemic attacks. What is the ischemic stroke? Actually, these ischemic strokes occurs most commonly, like 85% of patients which present with cerebrovascular attacks have the ischemic strokes, and these strokes may occur due to the patients who had the diabetes or others, like the hypertension. And when the arteries are stiffened, or the blocked, due to which the blood interruptions to the brain is uh, blood supply is interrupted. We see the ischemia. Actually, the most common mechanism due to which arteries are blocked is the arteriosclerosis. That is also called the stiffness of the arteries. And these are the actually the blood clots. In arteriosclerosis, we see the how the blood clots are formed inside the vessels. We see that actually, the fatty deposits within the arteries are the plaques, and this is also called the clots because there inflammation. After inflammation, the macrophages and some lipids come and sit together and form the plaque, and the plaque contains the depositions of the fatty substances, like we may see the lipids, the cholesterol sometimes in uh, people with hypercholestrolemia, and the other cellular waste products, the calcium and the fibrin. We see the fibrin is a meshwork, and it catches the lipids and other substances with it and sits in a site where it happened the endothelial dysfunctions. The mechanism of arteriosclerosis we see here. Actually, in normal artery, there is no interruptions of blood supply. We see there is normal flow of blood. The first thing that happened during the arteriosclerosis is the endothelial dysfunction. It may be caused due to many things, like there is a direct trauma to the endothelial, or due to hypertension, or some anticoagulants, like we give the drugs that thin the bloods, and due to which there is easily dysfunction to the endothelial. And as endothelial has ruptured or maybe injured due to trauma, the inflammation starts, and the inflammation due to inflammation, sometimes the neutrophils and then later the macrophage sits that catches the lipids and form the fatty streak, and we see the plaque forms after the fatty streaks and the fatty deposition. We see the two types of plaques, the stable plaque. If the stable plaque occurs, we see the ischemic strokes, and there is the time duration of the stroke is less in stable plaque. In stable plaque, we see the thick fibrous cap, due to which the rupture of the plaque is less probable. And in vulnerable plaque, we see the thin fibrous cap. Look at this. This is thick fibrous cap in the stable plaque, but in that case, we see the thin fibrous cap, and the necrotic core is more. And we see that this is more probable to be ruptured, due to which the stroke presentation are more rapid than the stable plaque. After the plaque ruptures, we see the neurological symptoms in stroke patients. That whole shows the mechanism of the arteriosclerosis. And the second most common type of the stroke is the hemorrhagic stroke. As you see, the hemorrhagic means the uh, hemorrhage means the rupture or the burst of the artery. Look at this picture. We have the bursting opening of the vessel, and the blood is coming out. Actually, the blood is leaked during the hemorrhagic stroke. When we see the blood is leaked inside the brain, there may be a flooded of blood in the brain, and the tissues may be interrupted from the blood supply. What could be the causes of the hemorrhagic stroke? In patients with hypertension, the vascular tone may be increased, due to which the hemorrhage to the blood vessels will occur. The trauma, the direct injuries may leak the vessels, and the anticoagulants, like the drugs that thin the blood, and the blood will be leaked easily. And the aneurysm, sometimes the invascular collagen diseases, the vessels are weakened, due to it aneurysms may occur, and then they uh, leads to the disruption and the busting of the vessels. And further, we have two types of the hemorrhagic stroke. The intracerebral hemorrhage means inside the tissues there is flooding of blood after the artery is burst. This is the inside of the brain tissues, and this is the most common type of the hemorrhagic stroke. And the subarachnoid hemorrhage, we have the space that is the subarachnoid space. Actually, this space is between the brain and the coverings of the brain. When bleeding occurs in the subarachnoid space due to the aneurysm, that is the most common cause of the subarachnoid space is the aneurysm. The aneurysm occurred because of the weakened vessels, and we will see the visual changes that occurs in the subarachnoid space bleeding or the subarachnoid hemorrhage. And the third type of the cerebrovascular attacks or the cerebrovascular accidents is the briefly interruption of blood flow to the brain. That is the transient ischemic attack or the mini strokes that mostly last not no more than 1 hour. And these are similar to ischemic strokes, and these are caused by blood clots or other debris that blocks the cerebral arteries for a short time. And we regard the transient ischemic attacks as medical emergencies because this occurs and the neurological symptoms may present. And because we actually indicate after transient ischemic attack that the artery is partially blocked or there is clot source from the heart, like in the heart the emboli comes and these clots comes to the cerebral arteries, and we should be aware for that thing that in future strokes that emboli may cause the ischemic stroke. According to the CDC, over a third of people who have not treated the transient ischemic attack will have a major stroke within a year. Within 3 months of a TIA, or the transient ischemic attack, the 10 to 15% people have the chances to have a major stroke within 3 months. That's why we should treat the transient ischemic attack as soon as possible, and it should be treated according to the guidelines. And that lecture I will give in the next videos. The first part of this stroke is finished. Thank you for your attention and hope to see you in next lectures.